There they are. I see them. I see them now. Oh, God bless America.
No, it's over here. It's by Nikki.
Huh?
Sure, by Nikki.
2 and 2 by Nikki.
Hi, Ray. Hi. All right, this is behind the camera. This is in front.
My chair. Get off my chair. My name's on it somewhere. It's not. It should be.
That's whatever.
Good.
Nothing I can do about it. All right. Everybody wave at the camera.
We are gathered here.
Okay.
I'll check the camera here a minute.
Okay. I tried to zoom in a bit. Let me take my sweater off so I can look professional and be cold and shivering the whole time.
Would you like to kick that car out of your way so you don't trip over it?
I'm a bit of a dancer. Oh, do I show my notebook before or after? I can't remember. Probably after. Probably after. I stapled my note cards to the back of them. Okay. All right. Monica Admin, who is a doctor of pharmacy, stated on marleydrug.com, an online pharmacy dedicated to providing high-quality products and services, June 2003, statins and Repatha both are effective at lowering cholesterol. To choose the right medication for you, there are a number of factors to consider: your medical history, side effects, interactions, and cost. In the next few minutes, I would like to explain the benefits of the drug Repatha over using a statin drug for your cholesterol issues. Let's see, my name is Jessica Luebke. Cholesterol issues have been a big issue in my family, as it may be for some of you, or someone you may know. Knowledge is half the battle. High cholesterol is a leading risk of cardiovascular disease and heart attack. Two criteria that would show Repatha being a better medication choice over a statin medication for cholesterol issues would be fewer side effects and having just a twice-a-week injection. First, we will look at Repatha medication having fewer side effects, and secondly, we'll use Repatha only being a once every 2-week medication. Now that we've gone over what we would like to discuss with you, let's go over the first criteria. Statin medications causing a little bit of muscle deterioration and also it having, more side effects. For cholesterol issues, Repatha medication would be the better option over a statin medication due to it having fewer side effects. Repatha medication is a superior option for a person's cholesterol needs. Alex Buehrer, who is a doctor of pharmacy, stated on Medical News Today, which is a medical online platform, stated March 2003, reduce the risk of heart attack or stroke and reduce the need for certain types of heart surgery in adults with heart disease. Brewer states Repatha helps your body remove LDL, which is your bad cholesterol, more effectively than it could on its own. Mild and serious side effects of Repatha are less severe than that of a statin medication. LDL cholesterol is sometimes referred to as bad cholesterol. Repatha works to lower the LDL cholesterol by helping your body get rid of the LDL more effectively. Statin medications are inferior to Repatha for their cholesterol needs. Stephanie Stisis is a graduate student in the Biomechanics and Movement Scientific Program in 2010 October with the National Library of Medicine, stated high blood cholesterol is a cardiovascular health risk that affects more than 1/3 of adults in the United States. Stephanie states statins are commonly prescribed in successfully lowering lipid medication that reduces the risk associated with cardiovascular disease. The side effects most commonly associated with statin involve muscle cramping, soreness, fatigue, weakness, and rapid muscle breakdown that can lead to death, which are more severe than Repatha. Statins causing muscle deterioration seem to be counterproductive since a person's heart is a muscle. Now that we've gone over the first criteria, let's look at the second criteria. Repatha being only a once every 2 week injection. For cholesterol needs, having a once every 2 week injection over a daily statin pill is less likely to be forgotten, which you would have less issues for breakthrough side effects and symptoms from having high cholesterol. Statins are a once a day pill to help reduce the cholesterol, and being once a day is challenging due to some being forgetful. Stephanie Stacy, a graduate student from Biomechanics and Movement Science program, October 2010 with the National Library of Medicine, approximately 25 million Americans are on statin medications. Using statins safely requires regularly monitoring for side effects. For patients that forget a dose, they are just to continue the next day, but for infrequent use, the medication has some more breakthrough side effects. But these are usually minor, such as diarrhea, headache, or feeling sick. No matter the medication regimen a person is on, if they're missing a dose, will lead to more serious complications later on. Repatha, although a once every 2 week injection, will have some breakthrough symptoms if forgotten as well. Alex Brewer, who is a doctor of pharmacy, stated on Medical News Today, March 2003, there are more than 1 million patients worldwide utilizing Repatha, mainly because it's a newer drug. Stephanie states that if you miss Repatha dose, take the next dose within the next 7 days of the missed dose. Then go back to your original dosing schedule. For infrequent use of the medication, many experience some side effects like a runny nose, sore throat, symptoms like of a common cold or flu-like. To change the medication regimen or dosage, please contact your provider instead of taking it upon yourself to change and suffer the side effects. Now that we've discussed why Repatha is the better alternative medication for cholesterol over a statin medication, let's wrap it up. In conclusion, in the next we've discussed in the last few minutes that the benefits of using the drug Repatha over the drug, statin drug, for cholesterol issues. High cholesterol is a leading risk for cardiovascular disease and heart attack. And the true criteria that we went over showed Repatha being the better medication choice over a statin medication, or fewer side effects, and Repatha being a twice a week injection. And Monica Admin, who is a doctor of pharmacy, stated on Marley.com, an online pharmacy dedicated to providing high quality products and services, June 2003, statins and Repatha are both effective at lowering cholesterol. To choose the right medication, there are a number of factors that you can use. Choose the best one for you and make sure you stay on your regimen. Thanks. She's got to see me go to the aisle, guys. Okay, 1, 2, 3, and 4. Ta-da! I would have laughed so